Hi, this is talking about psilocybin or magic mushrooms for the terminally ill and really looking at where you stand because what we're looking at coming up in the next few years is likely to be referendums putting psilocybin mushrooms on the ballot for legalization in some capacity in Maine. And I want you to be aware and informed about what the pluses or minuses are of that. I'm not taking a side on it. I just want you to know what the risks are and why people would want to do that. So, what are we talking about this? What happens is that from 2017 to 2019, before COVID, magic mushroom use had gone from 25% to almost 35% in 2 years. And people using it in the last 12 months had gone from 10 to 15% of people. So, a lot more people acknowledging use of mushrooms. And the underlying picture of that is the argument for legalization is that it can help people who are in terminal stage cancers or end of life deal with overwhelming death anxiety and that is worthwhile to at least explore. That's the idea. That's why people are putting it forward for the terminally ill. Right now, federally, mushrooms are Schedule One. So is marijuana. Just so you understand that basically marijuana is state legal, but federally legal, which means that technically the federal government could come in, shut down dispensaries, charge people with possession, put them in federal prison. Same thing is true for mushrooms at this point as well. Currently, what they're trying to do in a federal lawsuit is actually argue that people who are terminally ill have a right to try. Right to try means that there are experimental drugs out there are experimental treatments out there that aren't FDA approved, but if you're terminally ill, you should have a right to explore that because you're going to die anyway, technically, but also just because there's an argument that what is the harm? Basically, let me try this. So, right to try is people trying to do an end run around the federal law and saying, "Hey, these people are terminally ill. Let them try this. See if it helps them." The case that's currently being run through the courts right now is run by Erin Balsweller. She is a stage 4 cancer patient. She would like to try psilocybin, and she has doctors who are endorsing her ability to do that. One of them has actually gone so far as to find out to actually go. He's somebody who's tried mushrooms himself on his own, and he feels that he's gone to a manufacturer and found synthetic psilocybin. He wants to be able to give that to his patients. The DEA is going to make a ruling on that this month, January 2023. So if that comes through, there might be federally available synthetic mushrooms for the terminally ill starting not next month, but within the next 6 months. And so that's why it's relevant for you as a Maine voter. You want to know, hey, wait a second, is this something I'm into? Is this something I'm supportive of? Is this something I don't want to have? There'll be a referendum, I guarantee it, at some point relatively soon. And the reason I know that's going to happen is because it's just become legal in Oregon, and it's going to become legal in Colorado. And if we looked at the marijuana work, Colorado and Oregon were early adapters of that. Maine came shortly afterwards. So psilocybin or mushroom use is going to be on the referendum in sometime in the next 2 to 3 to 5 years. That's psilocybin on the left. It grows on cow manure. Someone else asked me, how does it grow on cow manure? I'm like, the cows swallow a spore or two and it grows. Cow poop is very fertile stuff and it grows on cow poop. I used to shovel it. There would be pounds of psilocybin on and no, someone asked me, did you take it? I'm like, no, I did not indulge in the cow poop stuff. I don't do that. But the point is that that's what it looks like. But again, one would never take a mushroom of any kind without really knowing what it was, because there are lots of cases of people really poisoning their livers using something they didn't know. The other thing to realize is that this is also in progress to be used as a treatment for depression, antidepressant resistant depression. And so they're looking at the FDA actually approving this for depression. And again, that's a whole other level of availability for other people. So would you be supportive of that? So for the terminally ill, is that something that you're supportive of? For somebody who just has depression, would you be supportive of that? So I went on, looked at the biology of this. So 60 patients with resistant to depression treated with psilocybin in 10 milligram and 25 milligram doses. Many people take gram doses of psilocybin. This is 10 to 25 milligrams, sufficient to cause brain changes. So larger doses, definitely not safe. Um, what happened is that people got the brain network, actually, the brain network modularity was altered within a day. So the brain was rewired. That resulted in a 6-month trial that actually showed that there were depressive changes after 6 months, and those changes were more evident than changes from Lexapro, which is an antidepressant, which is totally understandable because these people were antidepressant resistant anyway, so they weren't getting benefit. So there were changes, there was improvement in many depressive people's minds. How that it did that was likely that it caused the rewiring of the brain. So before, where depression would be, I feel depressed, A to B, B to C, C to D, and then I go down this depressive cycle, those neurons are gone, the body rewires, it might go A to B, B to C, C to A to D. So you've rewired it so it gives you more flexibility in how you think stuff, so you don't follow the same cycles. I have to mention that currently, if you have difficulty with mushrooms as being a possibility, and I understand that, it's completely a very valid point of view, we currently legally can prescribe someone with electroconvulsive therapy, electroshock therapy, basically taking electrodes, put them to the side of your head, or something between your teeth so you don't bite your tongue off, shock your head, burning the neurons between, so a mechanical, if you will, burning of the neurons between the um, the nerves, and so that you rewire the brain that way, and you can have amnesia from shocking your head. Remarkably, burning the inside of your skull with electricity does actually burn out neurons, and that causes memory loss. Interestingly, the memory loss does not actually correlate to depression relief. That's separate. So you can have amnesia and some depression, no amnesia and depression relief, or lots of amnesia and no depression relief. And so my hypothesis, which is an idea, I haven't proven it, is that the burning out of the neurons causes the regrowth of those neurons to possibly be in a more flexible manner, similarly to psilocybin. So psilocybin chemically altering the neurons, electroshock mechanically causing those neurons to be altered. Side effects of psilocybin: thinking distortions that can be emergency room stuff, perceptual alterations, and administrative issues. You can get the wrong mushroom. Bad trips are more frequent in female users. These are just surveys. This is not randomized controlled. Multiple doses, worse than single doses, and higher doses is high dosing psilocybin is the fastest way to end up in the emergency room, which completely makes sense. Just always taper up, taper down on anything that you're taking ever. Prescription drugs, anything, especially like stuff like non-prescription, anything like that, you want to really come in with the lowest dose and taper off, rather than people just taking a ton of something. It's never a good idea. All right, want to have this number in your heads. If we get psilocybin mushrooms for the terminally ill and you're visiting your grandparents or somebody that you know in the hospital, you need to understand that about 10% of people report feeling very aggressive and even being physically violent on psilocybin mushrooms. And having that kind of in the back of your mind means that when somebody is coming at you, you don't go, oh, wait, this can't happen because mushrooms are so harmless. You have to go, wait a second, this is a possibility. I need to make sure I'm safe. Then I can make sure they're safe. Okay. So also, so that can be a side effect, particularly in a sketchy situation where people are taking mushrooms on their own without somebody taking care of them. Never a good idea to go to a sketchy house with a sketchy couch and sketchy people and take sketchy things. Don't do it. Just don't do it. Why would you do that? Also, down at the bottom, you need to notice that there is the ability to actually increase persistent anxiety disorder using mushrooms, because you rewire the brain. Sometimes that rewiring causes more anxiety. So again, not a good choice. However, I want to put that in context with, this is in a clinical setting. You've got people there, counseling there. You've got crash carts if people have heart attacks. You've got everything available to support you. You've got people who are not on the drug taking care of you in a clinical medical setting. In that situation, there seems to be almost no violence. Other people have not reported violence as long as it's in this very controlled clinical setting. So people who are very safe and doing well don't seem to have the same problems. Psilocybin causes intense perceptual changes. It also causes nausea and vomiting, all sorts of other things. But synesthesia, hearing colors, seeing music, perception, temporal perception. So I put two images of Alice in Wonderland up there because it gives you an idea of altered reality. Also, to re-explore Lewis Carroll's own life in terms of what was he using when he was drawing all these pictures. Interesting side thoughts. The healthy individuals can have bad trips. Means confusion, agitation, extreme anxiety, fear, and psychotic episodes. And the relationship here needs to be very clear that if you are prone to psychosis, prone to episodes of losing um, your sense of reality, you are much more likely to do so on psilocybin. And this should not be surprising to people, but people are like, hey, I'm not really well. Let me take this psilocybin in an uncontrolled setting. And I'm like, no, it would be expected that you'd have a bad trip. It would be expected that you increase your anxiety. It would not be unexpected. So this is why you'd want to really have a clinical setting for this. You really want to have it. That's what people are trying to do, is to do this in a clinical setting. Here's a nice kind of word salad of what it feels like to have a bad trip, and just kind of looking at that, getting a sense of what it would be like for somebody to have a bad trip. So seizure, monitor, slot, police, hospital, ambulance, blah, puke, anxiety, all these things that people are having, just to give you a sense of what it might be like to have a bad trip without having a bad trip, which is what nobody wants to have. My plug for meditation, you knew this was coming. Many contemplative traditions aim at dissolving the sense of self, to open up yourself, and so do drug-induced ego dissolution is what this idea of the psilocybin is also doing that. So it can be done with meditation as well as with pharmaceuticals. And here's this wonderful image of an actual thing. Now I keep talking about a thing called the Shadowlands. Whoop, how come I ended up over there? I keep talking about something called the Shadowlands. I don't know why I'm up here and doing odd things now. Huh. Okay, hang on. I'm not going to worry about that. So if you look at this image up here on the right, you see what is kind of a brainwave mapping of regular reality, right? So this is the black dots. And then you see in the green, you see drug-induced alterations in reality. And then on the red, you see meditation-induced alterations in reality. And what's really interesting to me is this is kind of what I talk about with the Shadowlands, is this idea that we have normal consciousness, and then there's alterations in consciousness, like dream states, spiritual experiences, parasomnias, altered reality. And the idea is that you can get different places with meditation. If you notice, the big red is a little bit beyond what you normally see, the big green is beyond what you would normally see, and then you also have ego dissolution, basically less of what you normally think about, and you see green kind of losing that, and then also red kind of losing that. And what's really important about this kind of idea of the Shadowlands being this non set consciousness is that people who are having mental health issues will often feel like no one's ever walked the path that they've walked before. And that's not true. People have gone different places before and they've come back. And that can be very reassuring for people who are having a break, who are having an issue on their own, that they're like, oh, wait, no one's ever done this before. I'm like, people have done this before, and people have come back from it, either through psychedelics or through meditation. They've had hallucinations and they've returned to their normal state. And so this is for me to kind of put it all together for you in terms of like, your brain can change and alter, but it doesn't have to permanently alter. Side effect avoidance, I want you to look at this one. This is a fun one where somebody went on a meditation retreat and someone gave them psychedelics. I'm not sure I would have been a fan of that myself, but the idea is very low dose. And at the same time, I want you, for those of you who have no interest in meditation, read the bottom here, is that people who are doing psilocybin and meditation had all the psilocybin positive effects while counteracting possible dysphoric responses. In English, that means they didn't have bad trips, because they understood when things were starting getting out of hand, and they were able to bring themselves down into calmness, back down into a framework where they were in functioning. And that's incredibly important from a standpoint that, for those of you who will never do drugs, and I'm a big fan of you, the reality is that you still can have situations in your life where you end up kind of delusional or dysphoric or whatever, and to understand that meditation can be a means by which you are able to kind of calm yourself back down and come back to normal. Well, not normal, but back to a functional state of reality. 275 million meditators in the world right now. The mushroom you seek may be the one inside your head. You could just meditate your way into that. So that's my mushroom talk. I don't know where you stand on mushrooms for the terminally ill, but I hope you have more information about what that might entail. Thanks for listening.